Right now, somewhere close to 1 billion people are dealing with a headache. Not today. Not this week. Right this exact moment. That is not an exaggeration. It is closer to the truth than you might think. Headaches are so common that most of us stop treating them as a medical event at all. You feel one coming, you reach for a pill, you keep working. But how much do you actually know about what is happening inside your skull when that pain hits? Here is a strange fact. Your brain itself cannot feel pain. There are no pain receptors inside brain tissue. Surgeons can operate on a conscious patient's brain, and the patient will not feel a thing. So where does a headache actually come from? The pain comes from everything around the brain: blood vessels, muscles, and nerves in the scalp, neck, and jaw, all capable of sending pain signals when something irritates them. Your skull is basically wrapped in a pain-sensing shell. Ancient civilizations had no idea about any of this, and their solution was brutal. Archaeologists have found skulls thousands of years old with holes deliberately drilled into them, a practice meant to release whatever evil was thought to be causing the pain inside. Thankfully, we have moved on from drilling holes in skulls. But have we actually solved the problem, or have we just found a more convenient way to manage it? Walk into any pharmacy, and you will find an entire aisle dedicated to headache relief. Dozens of brands, dozens of formulas, all promising the same thing: fast relief so you can get back to your day. Have you ever wondered why headache medicine is one of the best-selling categories in every pharmacy on the planet? It is not because headaches are rare. It is because they are almost universal. Not all headaches are the same, though, even if we lump them together in conversation. Doctors actually separate them into different disorders, each with its own pattern, its own severity, and its own toll on daily life. The most common type is tension-type headache, a dull, pressing pain, often on both sides of the head, sometimes creeping down into the neck. Almost everyone has had one. It is unpleasant, but usually you can push through it. Migraine is a different animal entirely. Throbbing, often on just one side, frequently paired with nausea, and so sensitive to light and sound that many people can do nothing but lie in a dark, silent room until it passes. If you have never had a real migraine, imagine trying to work through the worst hangover of your life, except there was no party the night before, and it can happen again next week or the week after for years. Have you ever canceled plans, missed work, or skipped something you cared about because of head pain? If so, you already understand something researchers spend entire careers trying to measure: how much of ordinary life quietly gets erased by headaches. That measurement matters more than it sounds. Public health scientists have a way of tracking exactly how much healthy life a disease steals from a population, not just whether it kills you, but how much it disables you while you are alive. Diseases that kill people obviously grab headlines: cancer, heart disease, stroke. But headache disorders rarely kill anyone directly. And yet, when you add up every single day of function lost to head pain across the entire world, the toll turns out to be almost impossible to fully grasp. Consider your own week for a second. How many hours have you personally lost this year to a headache, either dealing with the pain itself or the after wave of feeling tired and foggy once it fades? Now multiply that by billions of people across every country, every culture, every income level. Rich or poor, headaches do not discriminate by geography. They show up everywhere humans do. One detail almost nobody expects: women are affected far more than men, and not by a small margin. Migraine in particular shows up roughly twice as often in women as in men. Scientists have long suspected hormones play a role. The sharp swings in estrogen around the menstrual cycle, pregnancy, and menopause all line up with changes in migraine frequency for many women. But it is not just about how often women get headaches. It is also about how long each episode lasts, and that gap widens with age, something researchers have only recently started to measure with real precision. Here is a question worth sitting with. If headache disorders are this widespread, this disabling, and this unevenly distributed by gender, why does it still feel like such an invisible problem? Part of the answer is cultural. Headaches are so ordinary that admitting one is disrupting your life can feel like an overreaction. You are expected to take a pill, grit your teeth, and carry on. That culture of pushing through has an unintended consequence, and it might be the most surprising part of this entire story. What if the exact behavior we are taught, take medicine at the first sign of pain, is sometimes part of what keeps the cycle going? Think about how you personally treat a headache. Do you wait it out, or reach for something the moment you feel the first twinge? Most people reach immediately, and most of the time that is a perfectly reasonable thing to do. But some people find themselves reaching for that same relief again and again, week after week, because the headaches keep coming back faster than expected. It starts to feel less like a fix and more like a routine. Doctors have a name for headaches that start to occur constantly, chronic daily headache, and it can trap people in a loop that is genuinely hard to escape without outside help. What actually causes migraine and tension headache in the first place is still not fully understood, even by the specialists who study it for a living. Genetics, stress, sleep, dehydration, certain foods, and even weather changes have all been linked to triggering attacks. It is a condition with no single cause, no single trigger, and, frustratingly, no single cure, which is exactly why so much research money and effort keeps pouring into understanding it better. So here is the real question this video is going to answer properly. Just how big is this problem on a global scale? And is the way most of us handle our own headaches actually making things better, or quietly making them worse? To answer that, a massive international team of researchers set out to build the most detailed count of headache disorders ever attempted, tracking data all the way back to 1990 and bringing it fully up to date through 2023. This was not a small survey. It was published in the Lancet Neurology, one of the most respected medical journals in the world, as part of an ongoing effort called the Global Burden of Disease Study, and it was funded by the Gates Foundation. The final numbers were staggering. In 2023 alone, 9 billion people, more than a third of the entire human population, were living with a headache disorder, a global prevalence of 34.6%. Tension-type headache turned out to be the most common, affecting nearly 25% of people worldwide, while migraine affected just over 14%. Fewer people get migraines, but do not let that fool you. Because migraine attacks are so much more severe than tension headaches, migraine alone was responsible for 90% of all the disability caused by every headache disorder combined. Rare does not mean mild. Added together, headache disorders now rank as the 6th leading cause of health loss on the entire planet, ahead of conditions that get vastly more attention and funding, responsible for 45 million years of healthy life lost in 2023 alone. The gender gap, the researchers found, was just as dramatic. Women lost more than double the healthy time that men did to headache disorders, driven by both higher migraine rates and longer individual episodes. And then came the twist buried inside the data. A condition called medication-overuse headache, caused by taking pain relief too often, turned out to be responsible for more than 20% of the entire global burden of headache disorders. For tension-type headache specifically, well over half of all the disability was traced back to overusing the very medication meant to treat it, a pattern the researchers called one of the most preventable parts of this entire picture. To be fair, that link comes from population surveys, not controlled experiments, so it shows a strong association rather than definitive proof that the medicine itself causes the extra headaches. Still, the pattern held up across regions large enough to take seriously. Perhaps the most sobering finding of all, these numbers have barely moved in more than 30 years. Despite every new medication and every awareness campaign, the overall burden of headache disorders in 2023 looks almost exactly like it did back in 1990. Researchers behind the study argue the fix is not just a better pill. It is better educated patients and better organized care, teaching people when acute medication helps and when it quietly starts working against them. So the next time a headache creeps in and your hand moves automatically toward the medicine cabinet, it might be worth pausing for just a second to ask how often that hand has made the exact same move this month. This video was based directly on the peer-reviewed study, Global, Regional, and National Burden of Headache Disorders, 1990 to 2023, a systematic analysis for the Global Burden of Disease Study 2023, published by the GBD 2023 Headache Collaborators in the Lancet Neurology in 2025, openly accessible for anyone who wants to read the full analysis themselves.